Hi, Claire.
Hi.
Thanks for joining me this afternoon to have a chat about some of the questions that we've been getting in through our webinars around the advanced practice review, but particularly around some of the work that's already been done through the Centre for Advancing Practice and the digital badge, etc.
Yep.
I wonder if we just kick off, Claire, if you can just tell me a bit about yourself, your background, why you got involved with the advanced practice review, and what impact do you think it's going to have on the profession?
No problem. Yeah. So that could take a while. No, I'm joking. So I'm Claire Sutherland. I'm an advanced practitioner, registered nurse by background. I've been involved in advanced practice since 2001. Commenced my training in Harlow, and then I moved up to Derbyshire in 2004, where I worked quite hard to try and develop advanced practice where it wasn't in place at the time, and developed a task and finish group, and then we developed a framework pre any of the what was HEE work at that point, any of the national work. And so I've been leading advanced practice in Derby and Derbyshire and became involved in the regional and national work. And through that work, I did some work for what was NHS Improvement with Mark Radford, Professor Mark Radford. And then when the NMC looked to start to review the possibility of regulation or additional regulation of advanced practice, was asked by Ruth May if I would, representing her and England in terms of advising the NMC, given my long history in advanced practice. And so, yeah, that's how I've ended up with you, and it's been amazing.
Thanks, Claire. Yeah, it's been an eventful, 14 months or so since we started working together, but it's been really great to have advisors, nursing and midwifery advisors, and a social care advisor as well from across the 4 countries to really get that 4 country perspective. And as we talk today, we'll understand a bit more about some of the anxieties out there, particularly within England, where they have developed their own framework for advanced practice and have this credentialing process through the Centre for Advancing Practice. So it's really good to be able to kind of talk about some of those things today.
Yeah, I think.
So, yeah.
Yeah, no, I was going to say, because I was part of the original group that developed the definition back in 2016, and then the first English framework, multi-professional framework. So I've been along that journey and sensed some of the anxieties that are out there, but also this experience of working with the NMC in the 4 countries, nursing and midwifery advisors, the standards team, the policy team, and the social care advisor. It's been quite a journey to hear through other people's lens, or see through other people's lenses what it's like for them, and that's, I guess, underpins why we need to do this work. It is really important. Public safety is really important. It's only growing, but it's challenging because lots of people have already invested a huge amount of time and energy, no more than all the practitioners that are out there, and we're very mindful of that. So I'm really pleased that I can be part of this work to try and make sure that their voice is heard really well, and that we steer this piece of work firstly in the public safety arena, but secondly make sure we're supporting and protecting all of our registrants. So yeah, it's really good to be part of it.
Yeah, thanks, Claire. And you're absolutely right. It's a really important piece of work, but it's complex and complicated piece of work as well. So, yeah, as we know. So I wonder, Claire, whether you can talk to us a little bit about what additional regulation of advanced practice and the work that the NMC is doing, what that means in relation to the digital badge from the centre. So particularly thinking about things like how we're working with the Centre for Advancing Practice and with other organisations who currently credential, so the Royal College of Nursing and some of the other Royal Colleges, and how the NMC's work will align with this.
Absolutely. So I think firstly to try and reassure everybody, there's a huge amount of engagement. The NMC is not looking to reinvent the wheel, but it has got a responsibility around public protection. Scoping out all of the existing work that's already brilliant work that's gone on, and all the hard work and effort, and no point are we looking to disregard anything. So working really closely and engaging with the Centre for Advancing Practice I'm talking from England perspective now. Obviously it's now NHS England, not Health Education England. They merged into NHS England this year. So NHS England Centre for Advancing Practice and who introduced the digital badge. That's really important work that we're taking account of, and having really good conversations with all of the team within the Centre for Advancing Practice, and learning about the processes. So mostly that's relating to the transition work that we're doing within the NMC for all of those existing practitioners who are working at advanced practice level. To make sure that when we bring in the additional regulation, that those practitioners, we know what they've already been through if they do hold a digital badge, what that actually means. But we also know lots of practitioners have done and linked into some of the Royal College work, so either Royal College of Nursing or, say, the Royal College of Emergency Medicine, Faculty of Intensive Care Medicine. We're aware of all of these credentialing. We've done a lot of scoping and a lot of talking with all of these colleges, with all of these organisations, to identify what it is that they've introduced, what processes, what standards, what evidence. A lot of it's around what evidence are they looking for when people are credentialing, and that helps us to identify in terms of a transition. Is that likely to meet the standard that we will put in place? And the answer is very likely. We can't say for definite at this stage because we haven't completed that work, but it's certainly not going to be a case that we reject anything and say you've got to jump through another hoop. We will be looking for a pragmatic solution to make sure that we meet a standard, that we keep the public safe. So lots of work ongoing. We have a steering group as part of this work who guide us, and there are representatives from all the 4 countries, from the chief nursing offices that sit on that. So, you know, registrants, and I'm one of them, you're one of them, Paula, we work for our countries, for our chief nurses. Nobody is looking to lose any workforce. I can 100% assure you this process that we're introducing is around patient safety primarily. I think there's also, what we've picked up from some of the discussions, is that there's a level of professionalising advanced practice as well. Most of the professions that we see that do have regulation, I know we've got primary regulation, but our advanced practitioners are working at significantly high levels now. It will add another level of professionalism to our practice. So really important, and lots of conversations going on. We're doing series of roundtables. One of those are with the Royal College of Nursing, and another one is with the other more medicalised Royal Colleges, because they have supported the development of advanced practice up to this point. Not to say in any way that advanced practice is equal to medicine, but we have worked collaboratively to develop advanced nursing practice. So we will be having really good discussions, what it means for them, and them helping us develop some of this work. Does that answer?
Thanks, Claire. Yeah, you mentioned the transition, and I suppose it'd just be helpful to understand. It sounds like you're doing some scoping work, but how long will that work take, and when do you think that transition work will be completed? And will there be an opportunity for individuals to get involved in roundtable discussions about that particular piece of work?
So yeah, I mean, the transition work is from listening to people. The transition is one of the areas that people are most anxious about, really, and that's not unsurprising because we're all out there working, doing the job as we do now, and so people are anxious. You know, am I going to lose my job, etc. So the transition work is started. it's a big piece of work, as you can imagine. What we'll be doing next year, so 2025, we will be starting off with a survey, and that's which we'd be really grateful for as many people to respond to that, because that will give us a little bit more of an idea about how many practitioners are working at advanced practice level. From where they have actually practiced. So we need to have a better idea about, across the 4 countries, about how many practitioners believe that they're or are working within an advanced practice role. And we're hoping that from that survey we'll be able to gather some more data which will help guide us in terms of having that pragmatic approach to transition. We're hopeful that from 2026 that we should be able to start the transition process. How long the transition process will be open for is still yet to be decided, but it will be a finite period. It won't be going on indefinitely, so there will be a finite period, but we're sort of a little bit guided by, it depends how many people we identify who will want to transition. So it's a bit of chicken and egg to go on there. We will definitely want to be engaging with people when we're a little bit further ahead. So it will follow similar patterns to the work that we've done. All the decisions that we make will involve listening and learning from our practitioners and our workforce and our educators, our researchers. You know, there's so many key stakeholders, but with the transition, primarily that will be those practitioners that are out there doing the job. And I mean, Paula, you and I joke about it, but you and I are part of that group. You know, I trained in 2001. There wasn't an MSc in advanced practice in my area, certainly at that time. And so I'm going to be one of those that will definitely be transitioning. And I will need to meet the criteria, whatever that looks like. So we've both got vested interest in not creating huge hoops for people to jump through, but we are also very mindful that all of this work and the responsibility of the NMC is around public protection. So yeah, we will definitely be coming to practitioners to support us. And so far, the contacts that we've had have been brilliant, and listening to you and your concerns and listening to your solutions is fantastic. So we're taking all of that on board, and I would anticipate that will continue as we move into this work stream, which is work stream 3. We are starting on it and we are working to it now, but it's going to be a long piece of work. So it certainly won't, you'll hear bits before 2026, but the actual transition process won't start before 2026 is my understanding, if that's right.
Yeah, and I suppose that kind of, you know, everything that we're doing, we've got a number of distinct work streams, haven't we? So we've at the moment been focusing on development of regulatory principles and our public first definition, and the roundtables and engagement that we're doing at the moment, that will be replicated throughout each of the work streams. So as we develop standards of proficiency, we'll again be engaging specifically on those standards of proficiency and those education program standards before we go out for public consultation. And similarly, you know, we've started the work, as you rightly say, Claire, on the transition process through work stream 3, but we will be engaging widely on that. And it's about that phased approach, recognizing that we want to do it once and we want to do it well, and we need to have the right conversations. And of course, you know, our independent steering group, we have to have those conversations so that they can make recommendations to our executive board and then onto our council, who of course have to approve all of the recommendations that we make before we move to phase 3.
I think the other thing to say is for practitioners, because there'll be a level of anxiety out there, I'm sure, around, you know, well, when's this going to happen? Is it imminent? I think it's worth saying we've done a lot of background work in phase 1, talking to other countries, doing a lot of scoping around what's out there in the UK already. Other countries, key people in particular, but I think New Zealand and America. I think New Zealand took something like 10 years to introduce regulation. America was something like 14 years, a bit more complex in America with all the states, etc. But it just goes to show the complexity of the piece of work that's being undertaken. So even if people don't feel like they're hearing a lot going on social media, etc. I can absolutely assure people there's a lot of work going on underneath, and a lot of conversations are needing to be had, because it needs to be a very rounded piece of work that we produce, that we consider all aspects, and most importantly, we want to avoid unintended consequences. We need to know and anticipate those and mitigate, so we don't suddenly think, oh, didn't see that result, that consequence. We need to make sure that we consider all of that. So it's worth, like you say, doing it once, doing it right, and taking our time. If that takes a little bit longer, then that's a better way than getting it wrong, and having to try and work around and find solutions.
Yeah, that's really helpful, Claire. So I suppose coming back to the original question around the digital badge, what you're saying and what I'm hearing is that the conversations have started. We're aware of all the work that's going on in that space. We are listening to our professionals as well, and as part of the considerations through that transition piece is really we don't want to make individual practitioners jump through unnecessary, overburdensome processes in order to be able to evidence that they're working at an advanced level of practice. But we're not quite there yet in terms of what that process is going to look like. Is that fair?
Yeah, absolutely. I think that's 100% fair. And I think one of the key questions that I get asked quite a lot if I'm talking to people is, do I start the digital badge? What do I do? And that's a very fair question, because it's a lot of work. I can't answer that. None of us should answer that. It has to be an individual decision. What I would say is both the NMC transition process and the digital badge both require you to have evidence that you're working at advanced level practice in whatever format that might look. And that's the bit that we've not worked out, is what's evidence going to look like. But I would want to try and reassure people that actually gathering evidence is really good practice as an advanced practitioner. You're in a fairly high risk role. You're making part of your experience and part of your skills that you have is the ability to manage risk. And so if at any point you were called to a coroner, heaven forbid, or you had to go into some form of legal process, you would be asked for the evidence of your practice. So it's really good practice to gather bits of evidence and maintain it. I think it's just trying to look at it slightly differently. It's not about jumping through hoops, it's about keeping you as a practitioner safe first and foremost. And that links in, you can link it into your annual appraisal with your employer. Just keep your portfolio up to date, and then you can decide which route you prefer to go. Probably an important thing to say in the digital badge, it's not a regulatory process. So it hasn't got any what we would refer to as regulatory teeth. It can't be enforced. However, we are very aware that there are some employers that are asking for the digital badge as evidence, and that's more so in primary care than it is, certainly I've not seen it so much in secondary care, but I have had a few conversations. It isn't an enforceable, an employer can ask for whatever qualification they want, really, but it's not got regulatory teeth, and I think that's what we're trying to get across. Whereas the NMC work is it's your regulator. You will have to meet those standards to then work as an advanced level practitioner. So slight differences, but both require evidence, and then it's for a practitioner to make a decision whether they want to go down the digital badge and hope that does all those requirements do meet. We can't say whether that's going to be the case, because that's jumping the gun a little bit, but we will definitely be taking the learning, looking at what evidence, in the same way we do. So there's lots of practitioners who have the RCN credential out there. The digital badge, probably what's really important also to highlight, we're a 4-country regulator. The digital badge is only applicable to England. And so the process that we put in place, if we said you had to have a digital badge in order to say transition, that would exclude the other 3 countries. We're not going to say you have to have a digital badge in order to transition across. So it's keeping in mind that complexity. If we're 4 countries, we've got different systems in place at the moment, but none of which at the minute are regulatory. It will be the NMC that will have the regulatory teeth, and that's the bit that you will have to make a decision whether you want to go on to the register if you want to carry on working at that advanced level of practice. So, but collecting evidence is great, and that's what you should continue to do.
Yeah, it's a really important point, Claire. We are the nursing midwifery professional regulator, whereas, what was Health Education England, now part of NHS England, the Centre for Advancing Practice, has a different remit. They're not a professional regulator in the same way. So we have different roles and responsibilities. Just like we know people confuse us with the Royal College of Nursing. We are not a Royal College. We are the professional regulator for nurses and midwives. I think that brings us nicely, your last comment there around the 4 countries and being a 4-country regulator. I know the NMC, the work that we're currently doing around the development of regulatory principles. How will they relate to the 4 nations advanced practice frameworks, which are all slightly different?
Yeah, absolutely. I think the principles is a really exciting development from the NMC, because it's opened up an awful lot of opportunity for us to work with a set of overarching principles that can go across the 4 countries, but allowing each of the 4 countries to keep their frameworks, because there was concern that, the countries have worked on their frameworks. There's massive overlay with each of the frameworks, but there are slight differences, and we know that people have invested a lot of time and their hearts into those frameworks. It's what they feel is required for their countries. And so I think the fact that we've got to have the overarching principles, but still therefore allow those frameworks to exist, will be, I think it will be a solution for everybody, rather than trying to create one framework that all countries have to buy into as part of this regulatory process. So really exciting. And then obviously the development of a patient-first definition, which will give what was highlighted out in some of the reports that have been released in relation to the Nuffield Trust report, and a couple of other pieces of research that we've commissioned through the NMC, was that need for the public to understand. And I think what's exciting is the NMC absolutely puts the public in the centre of this piece of work and handed over that definition development with support of professionals, but handed it over so we create something that they understand. The anxiety from professionals was, well, it doesn't actually look like any, there's a risk that it doesn't look like any other definition that we've experienced previously, and will bits be missing. The development of the principles allows us to put those, say, missing bits potentially into those principles. They're the gold standard. That's what good looks like for all of us. This is what each of our countries feel that advanced level midwifery. And so, yeah, really exciting that we're working hard on these principles, and again engaging with as many different groups of people and picking brains and trying to pull out those salient points that will be really useful for employers to make sure that we all work towards that gold standard. This is what is required, and our system regulators hopefully will be able to have a clearer understanding of what they're looking for when they're going into an employer who's got advanced level practitioners working with them, and what they need to be looking for to ensure that we're all delivering safe, effective practice. So yeah, very, very exciting.
Thanks, Claire. I just wondered, there's a question that we've had around whether we are going to define different terminology within nursing and midwifery practice. And by that, we're thinking about kind of clinical practitioner, specialist practitioner, advanced nurse practitioner, advanced clinical practitioner, because we know that there are a lot of different names and titles out there, and I just wondered if you could expand on that a little bit in terms of the work that the NMC is doing.
Yeah, absolutely. And I think it's partly what's driven us to need to look at this piece of work is the variation. And we know that Professor Leary did a piece of work around titles back in 2017, I think it was, and found huge amounts of variation, some of whom who had advanced in their titles, but some of whom weren't even regulated healthcare practitioners. So, a lot of confusion for healthcare practitioners, huge confusion for the public. So very difficult. So what is often confused is that specialist practice, advanced clinical practice, etc. For the NMC, for the purposes of regulation, regulating advanced practice is regulating it at a level of practice, not a role, not a title. So it is going to be the level of practice. Nurse is not currently a protected title. I understand it might be being discussed as part of regulatory reform, but it's out of our hands as part of this work at this moment. But it is part of regulatory reform discussions. I think it is very important that we recognise that as a level, you could be a specialist practitioner. The scope of practice is not going to be defined by the NMC. We're not going to dictate the exact scope of a practitioner. You may do X, Y, and Z. It will be about the expectations around the level of which we expect you to practice, which is very likely to still follow the 4 pillars of advanced nursing and midwifery practice. So that we've learned from phase 1 of our work. We did a lot of scoping internationally, and we learned from there that some of the countries that have defined scope had to actually lift that or an increase or remove their language around scope, because actually it restricted clinicians, practitioners being able to deliver safe, effective care to patients. And so there was a lesson learned. That's what was so good about doing the amount of work that we've done. It's not something the NMC does currently, and we're not looking to define somebody's scope, but we recognise you could be working in a very niche specialist area of practice, and yes, you could be working at advanced level if you meet the criteria. On the other hand, we know across England in particular, we have roles called advanced clinical practitioners. I have them in my own trust, who are very broad, and that was developed to meet service needs. So no criticism to any practitioners that are called an advanced clinical practitioner, or whether you're an advanced nurse practitioner, or whether you're a specialist practitioner. If you meet the criteria that we are developing those standards, then you will be defined as working at that level against whatever title your organisation might have given you. Now, in an ideal world, I'd have to say, as a practitioner out there, it would be in some respects great to have everybody who's working as an advanced level practitioner called almost the same thing. So all advanced nurse practitioners would be on the register, and you could only be on the register. You could only work and have that title if you were on the register, but that isn't currently the case. It's not to say it won't happen in the future, but focusing that this is level of practice. If you're a specialist nurse, don't panic. You could still, if you meet the criteria, you could apply to go onto the register as an advanced level practitioner. On the other hand, if you're an advanced clinical practitioner, you can do the same. So the title isn't going to be a barrier. It's anybody that wants or feels that they are working at that level of practice will be expected to demonstrate that they are through evidence in one way, which is what we're working on at the moment, or having exited in the future an academic program that has met the standards in the same way our nurses and midwives do currently. So yeah, that the actual titles, which are confusing, it's not being related directly to that. It will be the level of practice that you're working at, and you being able to demonstrate that you're working at that level, if that makes sense.
Thanks. It does make sense. Thank you. So I just wondered whether we know that there's a lot of work been going on to looking at and defining enhanced level practice, advanced level practice, and also consultant level practice across nursing, but also across other professions as well. And I just wondered if you could expand on whether we'll make reference to those other levels, particularly consultant level, which often builds on advanced level of practice.
Yeah, I mean, that is a really good question. This piece of work, the remit is advanced level practice, but we are very mindful of the levels of practice either side of advanced practice. the work by the NMC and picking this up and having the advisors was partly driven by all of our chief nursing officers across the 4 countries and our chief midwifery officers, with a recognition that actually advanced level practice in workforce plans across the 4 countries is specifically mentioned and being pushed forward, and that increase in number, alongside the absence of regulation at that level of practice, was felt to increase risk, and that's what the Nuffield Trust report identified. So as part of this review, consultant and enhanced won't be, the focus is not on enhanced, but all of the advisors, which is partly why the NMC have got us there as advisors, is to make sure that we consider impact on the enhanced and consultant, the workforce around it, basically. But in terms of regulating, it's regulating of advanced level practice on this occasion. And that's not to say in the future that potentially consultant, as you mentioned, which is that career development pathway from advanced into consultant level. There's lots of work going on, certainly in England, which is obviously what I'm representing. We've just employed a lead for consultant level practice in Professor Rob Crouch. We're working closely with NHS England, with Professor Crouch and the team, so that we're very mindful of the work and that we don't contradict work that's going on, that hopefully the work that the NMC does complements, and potentially in the future, who knows, there might well be annotation on a register for consultant level practice, but at this time that's not the focus of this work.
Yeah, thanks, Claire. I think it's really important to make that clear, but as you say, it might be something that comes out as a recommendation of this piece of work to look at consultant level practice, next. I think there's probably one more question that's come through around our understanding of how the work that we're doing may have influenced the current workforce plans across the 4 countries. And I guess, turning that around, how the workforce plans are influencing the work that we're doing, and whether you might be able to say a little bit more about that.
Yeah, absolutely. So
For
obviously, NHS England released its long-term workforce plan, which mentioned advanced practice, increasing numbers of advanced practitioners to support with the long-term workforce plan, and that did prompt, It was part of the options appraisal that we put in. It had to be a consideration that certainly the other workforce plans in the other 3 countries also looking at how do we as an NHS manage service going forward over the next 10, 15 years. We know we did in phase 1, we did one of our key lines of inquiry was about task shifting, which was quite a contentious terminology, but it is a terminology that's recognised, and so we decided to keep with it. Really what we're talking about is that healthcare moves forward. Medical knowledge doubles every, I think it was every 72 days when I last looked. That's massive. Nobody can manage taking healthcare forward and keeping hold of all additional roles and skills that they used to have. So if we look back over history, if you look at how medicine's changed, if you look at how nursing has changed over in my career, so I've been nursing for 38 years, what I see and we do now is very different for how it was. We had doctors doing first-line antibiotics. There used to be doctors doing urine dips. It has changed hugely. And so our workforce plan has to consider that change in how we work, how we deliver services, and to make sure that we carry on delivering safe, effective care for our patients. We've got to bring in new roles. We've got to look at working differently, and that will often mean, certainly from a nursing and midwifery point of view, we will expand our skill set, our knowledge and our skills and how we work, the patient always being at the heart of it. But really important that's tied into and driving. We know we're going to increase numbers of advanced level practitioners. It's very different to, say, how I qualified. The work that I did as a qualified nurse on day one is very different to what I'm doing now. And so it sort of brings us back to that first question, professionalising advanced level practice, making sure that we are annotated. We're already on a register. We're still responsible and accountable for our acts and omissions. You know, we work to our code. But there is another level, and it was felt when we put the options to council, there is definitely sufficient risk identified to warrant regulating this level of practice. And so I think, you know, our workforce plans are absolutely tied up in this. It is a mirror of what's happening going forward, and so really important that the NMC is responsive to workforce change, and they're working very closely with the 4 country chief nursing officers and midwifery officers to make sure that we work hand in hand. It's not a them and us, it's a how we work together to deliver safe, effective care, and that's what we'll continue doing. And really important that we carry on having very close relationships and conversations with our 4 countries. So yeah.
Thanks, Claire. I think you've brought us nicely to a close, really. But I think it's been a really helpful conversation, and I hope that we've covered a lot of the kind of queries and the anxieties and questions that we hear when we're out and about, which we do a lot of talking to people through our engagement, but more widely and more broadly as well. So hopefully we've reassured people. There is an opportunity, as I say, we've got a number of work streams that will be undertaken as part of phase 2. So if people do want to get more involved, they can go to our website and sign up to our community of interest. If people have got queries that they feel that we haven't been able to answer today, or they'd like a bit more information, we love to hear from people, so we will respond to you. You can email us on advancedpractice@nmc-uk.org. And like I say, we'll be happy to come back to you and have a further conversation. So there's just to say thank you, Claire, so much for your time, and it's been a really great discussion.
No, thank you. No, it's been brilliant. I'd also just say there's also the frequent asked question page that I direct people to, and if they can't find the answer there, then like you say, do get in touch with us. We love to engage with you, and we'll do our best to answer and reassure if we can. But yeah, no, I have to thank, because I've been at this since 2001. I remember regulation being discussed previously, so it's a really great way to potentially end a career with introducing something around a role and a level of practice that I'm so passionate about. So have to thank the NMC for driving this forward before I retired. That's fantastic. Thank you.
Thanks, Claire.